Today we're going to talk about what you're supposed to do after getting a vasectomy. A vasectomy is an effective method of permanent birth control, performed in a doctor's office under local anesthetic and lasting less than 15 minutes. It is clear that proper care after a vasectomy will ensure the recovery and that it is a satisfactory one. Let's just talk about what to do after your procedure. Proper care after a vasectomy will ensure that the recovery is satisfactory. Complications are just more common if the post-procedure instructions and recommendations are not properly followed. Initially, after your procedure, plan to spend a quiet evening at home, reclining in a bed or lounge chair. Minimize activities that include pulling, pushing, or lifting heavy objects. Bearing down increases the pressure inside your belly, and this gets transmitted into your scrotum, and therefore it could lead to the break of a small blood vessel that can create a blood clot or some bleeding in there. Remember to use tight underwear or a scrotal support like a jockstrap for comfort. On the day after the procedure, you may walk and drive as much as you would like. You need to avoid sports, yard work, swimming, and heavy lifting of any kind during that time. If your job is sedentary, like office work or a supervisor, you actually may return to work. 2 days after the procedure, you may return to more strenuous work and regular activities wearing your scrotal support. Wait 3 days for aggressive sports such as basketball and tennis or things of that nature. Remember, you can take acetaminophen, which is Tylenol, or ibuprofen, which is Motrin, or even naproxen as directed if you have any discomfort, but truly many patients don't need them. You also may apply ice intermittently over the area of the procedure. You can do so for 30 minutes and then remove it for 30 minutes, so on and off over the first 4 hours after the procedure. Just make sure that you keep the area dry to avoid any infections associated with this. You may take a daily shower beginning the morning after your procedure. Replace the scrotal support and wear it whenever you're standing for the next couple of days and during activities, particularly strenuous physical activities, for the next 7 days. You may have intercourse again 5 to 7 days after the procedure. It is common to have some blood in the semen, so don't be alarmed during the first couple of ejaculations. Remember to use other forms of contraception until your semen sample has been checked in 12 weeks and you are told that your semen is sperm-free. Since no incision is made, a follow-up visit is actually not required, but if you have undue discomfort or any concerns, make sure to contact your surgeon. It is normal to have some discoloration of the skin around the puncture site. Some men even will develop considerable discoloration of the scrotum a couple of days after the vasectomy. This is related to some blood from the deep tissues of the vasectomy site that comes up to the surface as a purplish blue mark, gets darker and spreads out like an oil slick, but it gradually goes away. It is not a hematoma, it's just a bruising, a superficial bruising. Some men, about 1 in 20 or so, will develop swelling and discomfort on one or both sides, starting anytime from 3 days to 3 months following a vasectomy. This usually represents an exaggerated form of the normal inflammatory response necessary for the sperm to be absorbed and recycled. It is best managed with a 7 to 10 day course of either ibuprofen, which is Motrin, or naproxen, which is Aleve. So some of those instructions on how to take the medication will be given to you. Finally, at least 12 weeks and 20 ejaculations after your vasectomy, a semen sample should be analyzed to confirm the success of your procedure. This sample should be produced after a 2-day period with no ejaculations. So these are the 5 things you should remember after your vasectomy. First, proper care will ensure adequate recovery. Second, reduce your activity during the first 48 hours after your procedure. Third, you may use ice or over-the-counter anti-inflammatory medications as necessary. Fourth, you may resume sexual activity 5 to 7 days after your procedure. And finally, a semen sample needs to be checked 12 weeks and 20 ejaculations later.